Welcome to the Preventive Medicine Podcast. Help us change the paradigm of medicine from keep people alive to help people thrive, one episode at a time. And now, here's the show. Because you have so many different perspectives, it's going to be interesting to ask you, what does preventive medicine mean to you?
And it's interesting because I feel that in many ways we segregate things and people have always said to me, oh, you could easily, become board certified in preventive medicine because I did an MPH, I did clinical training, I'd only have to do a year of something. And then, I could take the boards. And I'm like, you know what? I don't need that title per se of having another certification, because I think much of what I do in internal medicine is preventive medicine, and I'm interested in that. So I'm very focused on making sure that people get screenings. I'm particularly interested in discussing lifestyle of healthy eating. And let's be honest, most doctors aren't. They also don't know how to give advice. They tell them, you need to lose weight, you need to go to the gym. That's not helpful to patients. So I don't think preventive medicine, sometimes when it's like, oh, well, you go into preventive medicine and that's what you do, or you don't. And I don't think it's that divided. I think many areas of medicine, we focus on preventive medicine in terms of how do we prevent or delay, various diseases and conditions. Yet at the same time, we're trying to have this 360-degree whole health approach for patients. We know this in the social determinants of health. It's not just about access to the healthcare system. It's about access to fresh fruits and vegetables. It's about access to the ability to be able to go outside and be active in a safe environment. It's not necessarily about going to the gym. So it's about all those important elements of the total care of patients. And even in my role at WebMD, we cover a lot of stuff on heart disease and stroke and cancer. But one of the things I'm interested in terms of writing a book is how do we help prevent cancer, right? So that's preventive medicine, but that's everything else as well. And the reason why I focus on that is I don't want people to feel that, oh, you're either preventive medicine and you're something else. It's all a continuum. And sometimes folks in medicine, to be honest, don't respect preventive medicine. And that's a challenge as well.
Yeah, I think that's a true travesty that for some reason people don't respect preventive medicine, because I think from our perspectives right now, when we look at medicine, when we see the rotations that we've been on, that preventive medicine is kind of just eat right and go to the gym, and they don't think about anything else.
And when you think it's easy, exactly.
To do that.
Yeah, right.
Yeah, they think a preventive medicine visit is where a patient comes in, you just tell them to go to the gym and then eat right. And that's pretty much it. And then right now, when we think about medicine, not really incorporating that preventive medicine aspect, we think about just like the acute treatments and interventions that happen. We think about someone going to surgery. We think about someone getting prescribed some medication and so forth. So like how you've mentioned that medicine in like an actual practice should incorporate everything, because the end goal is the patient's health. And the ideal situation is that they don't get put in the situation of whatever they're in the first place. So I like how you mentioned that.
Yeah. And I think that one of the unfortunate things is that preventive medicine sometimes carries with it connotations of kind of snake oil salesman sometimes, because there are a lot of people who use the term preventive medicine who aren't trained physicians or even trained at anything. And they try to sell some product or some program or and I think that's one of the issues too, is that there's people who think of preventive medicine as, oh, that's just someone selling some product or trying to get someone who
we're lifestyle coach. We're not coaches.
Yeah, exactly.
That's not what it is. It's still, a very evidence-based, curriculum with a strategy to have an impact on people's health.
What do you think the most important part of preventive medicine is then, from your perspective? Or is it kind of just all like a balance that you kind of have to put together?
I mean, effective communication is key in all areas of medicine, but I think in preventive medicine, it's particularly important. So we don't communicate messages well to patients. We have a parlance in medicine that people don't understand. This is coming up now in antibody testing. Most people don't understand what specificity and sensitivity means. And let's not go down positive predictive value on a 2-minute television interview, but those are important. But how do we figure out a way as physicians and health professionals to become good communicators? So we explain to patients why this matters. So in preventive medicine, it's not at the time when people have a stroke or have a heart attack that now we say, you know what, you have to implement these measures. And let's be honest, often that only works for a short period of time. We don't help them understand why they might want to do certain things. And it's not about, big brother or being paternalistic and telling them this is what you have to do, but helping them understand if you make these changes, you may have a longer life. You may have a higher quality of life. And it takes different strategies. There's something called the blue zones that you may know around the world. Nat Geo, a competitor of Discovery, did a very good show on it, years ago. But they didn't say, eat the Mediterranean diet, be active this amount of time, you need to focus on friends. What they did is they told these great stories. And they showed this great imagery. And then they gave people tools of what you need to do to live to 90 and want to live to 90 as well. And I think that's the challenge. And we don't communicate well. So as you said, going to the gym, that doesn't help anyone, or lose weight, or you need to eat more fruits. What am I going to do with that? We need to get people in many ways the same type of prescription as we do in terms of, take this cholesterol lowering medicine. So I think a key element there is communication, but then it's also getting that evidence base as well. So to your point, it's not about, snake oil and stuff like that. So we're not just telling people to take, a vitamin. Let's talk about what's the evidence for vitamin D and, and who's it for? What are the different aspects of, who might need, a supplement? The reality is most people don't, but there are nuances of when that could be the case. And I don't think we traditionally have communicated that well to patients. And that has been a challenge in preventive medicine. And we don't talk to them about the importance of screening. Many people don't come to their colonoscopy appointments, and there's multiple reasons why that is. But how do we more effectively communicate that this is going to have an impact on your life? And the challenge is it might not come for many years, and we're not used to that. We want to take a pill now and see our blood pressure decrease. We don't want to have to decrease salt and, reduce processed food and wait, several weeks to see some impact on our blood pressure. But the reality is, in many ways, many of those changes can have as big of an impact as taking a pill.
Yeah, I think that's one of the things that I think people have a harder time understanding when it comes to the doctor, patient, or physician patient interface, is that really that building that alliance is such an important part of the process. And it can't happen in a one-time 10-minute visit. Someone's going to trust the things you say, especially in the preventive medicine sense. They need to know that they trust you and that they have a relationship with you where there can be an honest feedback, and where you can, I guess, really gauge that they understand why these interventions are important and how to implement them. Like you said, I think a lot of the times we just kind of throw recommendations at them instead of, you wouldn't just say, well, take some of this lisinopril or take some of this medication. Right. You same thing with going to the gym. They need a prescription of on Monday, Tuesday, Wednesday, Thursday. Here's what you're going to do at the gym. And here's what the diet looks like. Here's how we're going to help you reduce your caloric intake. It's not just, well, you need to stop eating as much.
And then it's also about communication from the patient as well, because a lot of times it feels like patients don't necessarily tell you about their circumstances or situation. So if you're telling them to go to the gym or to eat these kinds of foods and then giving them a prescription, they might not have access to those things, which also becomes a huge impediment or something they have to overcome to reach there. And then oftentimes they're like, I can't overcome this. And then they just don't do anything. So I think the communication is important both ways between physician
and it is about language. Everyone doesn't have time to go to the gym based on, where they live and their situation. So it's really about being active. And how do you, create a stress on your body? I do my research, you're tracking carbs or macronutrients or something. Okay, that works for you. That doesn't necessarily work for everyone. So we have to give people tools that's going to work for their life as well. So those folks that can go to the gym is great. Some people don't. And I'm sure you know this. I've heard from many patients that have told me over the years they have to get in shape before they can go to the gym. And it's like, well, maybe that's how it is in DC and some other places, maybe LA, but that defeats, the whole purpose. But in their mind, if that's the case, there's things that they can do at home. There's things that they can do with their body weight. It's always better than doing nothing, which is what majority of people really do. And I've had patients that say, well, they walk around at work. Okay, that doesn't count. I try to, tell them that. But most of our, colleagues aren't trained in this, and they get frustrated by it because they don't give good information to patients, and then they don't see results, and then it's a self-fulfilling prophecy. They think it doesn't work, but they've never given patients good advice. And let's be honest, it's very confusing as to what you should do. Should you do keto? Should you do Mediterranean? What's the role of intermittent fasting? Patients are confused, and unlike WebMD, there are a lot of sites out there that give misinformation, and that potentially harms patients.
Preventive medicine is an incredibly important topic. I want to thank you for taking the time to watch this video. For the full episode, find us on your favorite podcast streaming platform. If you enjoyed this video, don't hesitate to hit that subscribe button, like this video, and share it to keep that message spreading. Thank you once again for watching this video, and we'll see you in the next one.